JJ, a 19-year-old boy in a wheelchair with an iPad on a mount in front of him for communication. Then his mom preparing sandwiches in a kitchen.
Even pre-pandemic, accessing home and community-based services was a struggle for many families. The pandemic just expounded upon that.
Rachel Siegel McLaughlin, the intake director at Disability Rights Florida, speaks. She is a Caucasian woman with shoulder-length brown hair and thin-rimmed pink glasses, sitting in front of a large number of books on shelves.
We've had Florida families who've not been able to access HCBS services due to being placed on the wait list, and those families have faced these struggles of finding care before the extra struggles of the pandemic.
JJ's mom feeds him a bite of a sandwich. Then shots of JJ's dad and dogs as JJ speaks using his iPad as an AAC device.
My name is JJ Holmes. I'm from Longwood, Florida. I live with my mom and dad and my little sister and my 2 crazy dogs.
JJ smiles.
I'm 19. I will be graduating in May.
Allison Holmes, JJ's mom, sits on the couch next to her husband, then feeds JJ a drink through a straw.
In Florida, when you have a child with disabilities and they can't live independently, there's a waiver program, which means that they can continue living at home with help instead of going into an institution.
Close-up of an accessible parking permit dangling from the rearview mirror of a car as Allison drives.
But because there's so many people in Florida waiting, you go on a wait list instead of being accepted into the waiver. We got on the wait list in 2007 and have been for 16 years.
Allison helps JJ roll into their accessible van.
I'm picking up JJ from high school. He comes home for lunch, so take him home, feed him his lunch, take him to the bathroom, and then back in the car and back to school.
JJ types a message with his nose.
Mom, when do you think I'll get off the wait list?
No idea.
Rachel.
That wait list is over 22,000 people. That's a lot of individuals who live in Florida who aren't receiving home and community-based services. Individuals who are not able to access HCBS services, their families face exhaustion, financial crisis, and eventual institutional care if they're not able to meet their family members' needs.
JJ arrives at home, and his dad Joseph, a man with dark hair and a gray mustache, helps him get out of the van. Then Joseph speaks as he sits next to his wife on the couch. She has a small dog in her lap.
I'm almost 70, and I just can't imagine how many 70-year-olds are out there that's got to do the things that I do. We both have back issues, carpal tunnel. I was supposed to be getting a surgery on it, and I have to keep putting it off because the downtime is a minimum of a month. And who's going to care for my son in that month where I can't lift him?
Joseph lifts JJ from his wheelchair and helps carry him to bed. Allison.
Most parents think about, well, if I died, I'll do this for my kids or that for my kids. We can't even think about it because what would happen is just so awful to think about.
JJ speaks with his iPad.
The thought of having to live in a state-run institution keeps me up at night.
JJ out in the community going grocery shopping with his mom. Rachel.
It's important for people to be able to live in the community instead of an institution because institutions are very segregating. Individuals with disabilities experience abuse and neglect in institutions.
News headline from the Tampa Bay Times. COVID is leaking into Florida nursing homes and cases soar. Then, Florida leads nation in nursing home resident and staff COVID-19 deaths.
Additionally, during the COVID-19 pandemic, we saw that the COVID virus spread very rapidly once an institution had an outbreak. And those patients who were living in those facilities were isolated from their families and friends. The U.S. Supreme Court's Olmstead decision in 1999 found that states were now required to provide services to individuals with disabilities in home or home-like settings, which would mean that they were no longer forced to be in institutions. But even when you have services approved and ready to be funded, it's very hard to find home care workers to provide those services.
Annette Diaz, a white Hispanic woman with shoulder-length blonde hair, speaks.
Hi, my name is Annette Diaz. I live in Pembroke Pines, Florida, with my daughter, Catherine.
Catherine, a young woman with disabilities, is transferred to her wheelchair by a PCA.
Catherine got on the waiver in 1999. It's good for her health, it's good for her well-being. She's integrated into society as well.
Catherine in her wheelchair being pushed by her PCA.
I have to be able to trust the person that comes into the home because Catherine can't communicate anything to me. So I have to be able to know that once I walk out that door, that she's being taken care of the way she's supposed to be.
Clips of Catherine being taken care of by Annette and other PCAs and care providers.
Once the pandemic hit, we lost one of our nurses. She had been with us 19 years. Marie. We love her dearly.
Photo of Catherine and her nurse, Marie. Catherine is smiling.
I haven't been able to find a nurse to fill in her time slot.
Rachel.
During the COVID-19 pandemic, we faced a shortage of home care workers because home care workers were either leaving the field or they were becoming ill where they could no longer work in individuals' homes. According to a study by Anchor Foundation, United Cerebral Palsy, as of fall 2021, 77% of providers were turning away new referrals, and 84% were delaying the launch of new programs and services due to lack of staffing.
Annette.
It's just become impossible to find personnel.
Annette prepares to feed Catherine via her feeding tube. Then, Annette pours the food into her tube.
I work 4 nights a week, 4 16-hour shifts. Then I have the personal care assistant in the daytime. She's here only 8 hours, but she can't do everything for her either. So it's not even that I can hand her off and leave her with her. I have to do certain things like feed her.
Trying to sleep that's something that I don't remember the last time I did well.
Some of the big picture solutions includes the states fully funding our home and community-based waiver programs, investing in our home care workforce, and then we need the states to invest in other community-based providers that individuals would need to live a full life in the community.
JJ out getting frozen yogurt with his family. Allison.
Let's make sure he stays out of an institution. Let's make sure he's a member of society.
Close-up of JJ smiling. Allison is in the background, holding a cup of frozen yogurt. Then, Allison feeds him some.
He needs help with self-care, but his nose it can do a lot.
JJ typing on his iPad with his nose as he speaks.
I'm very excited about graduation. I have very big ambitions.
JJ rolling into a government building. Then, JJ and Allison on a local TV station, speaking in front of a legislative delegation.
I want to become an advocate that fights for marginalized communities, and maybe even run for office one day, but I don't know when I'll get off the wait list.
Annette.
It really is a great program. It's just not available for everybody, and that's the hard part.
White text on a blue background that says invest in home and community-based services. COVIDimpacts.us. Logos for Disability Rights Florida, Disability Law Center of Alaska, Arizona Center for Disability Law, and Block by Block Creative.